Hello, welcome back to the channel. Today we are looking at a sensitive issue that is gaining more attention across South Africa and beyond. Refugees and asylum seekers are raising their voices, saying that they are facing healthcare discrimination in the very country they sought safety and better lives in. Please watch until the end so you can hear the sources and try to verify the news for yourself. Before we continue, don't forget to subscribe to the channel and stay tuned for more updates like this. The issue of refugees and asylum seekers in South Africa has always been a complex one. On one hand, the country's constitution is among the most progressive in the world, guaranteeing the right to access healthcare for everyone who lives within its borders. On the other hand, the healthcare system is already under huge pressure, with limited resources, staff shortages, and overcrowding in public hospitals. It is within this tension that refugees and asylum seekers say they are being treated unfairly, facing long waits, denial of services, or even being told to go back to their home countries for care. Some refugees argue that their refugee and asylum permits are not always recognized at clinics or hospitals, with officials often questioning their legal status before treating them. In practice, this means that people who already went through so much trauma to reach safety are being put in situations where they have to prove they deserve basic health care. Advocacy groups working with migrants have spoken about cases where women were denied maternal health care or where children were refused treatment because their parents did not have proper identification documents. From the healthcare workers' perspective, the picture is complicated too. South African doctors, nurses, and administrators are working under immense strain, trying to stretch limited budgets and resources across millions of patients. Some feel that the government has not put in place enough clear guidelines on how to handle refugees and asylum seekers in the healthcare system. Without clear rules, healthcare workers may fall back on their own judgments, which can lead to unequal treatment. This issue also taps into broader debates about migration in South Africa. Many locals already feel that the country's resources are stretched thin and that the state is struggling to meet the needs of citizens. In that context, some argue that refugees and asylum seekers should only be entitled to emergency healthcare services and not the full package of care. But human rights organizations and international bodies push back strongly against this, saying that denying healthcare to refugees violates not only South Africa's constitution but also international agreements that the country has signed. The testimonies of refugees and asylum seekers bring a human face to this debate. Imagine a mother fleeing conflict in her home country, only to find herself queuing for hours at a clinic in Johannesburg and being turned away because of her documents. Or a refugee father working small jobs to feed his family, but unable to get treatment for his child's illness because the clinic staff say he must pay full costs up front. These are the realities many refugees say they are living through, and they are calling on the government to take their plight seriously. Politically, the issue is becoming more heated. With elections on the horizon and migration already a major talking point, some political parties are framing healthcare for refugees as part of a bigger problem of illegal immigration. They argue that the state should prioritize South Africans first. Others, however, stress that compassion and justice must guide policy, pointing out that many refugees are victims of wars, persecution, or economic collapse in their home countries, and they did not choose to be in these situations. Health committees and human rights watchdogs have already flagged this issue as one that cannot be ignored. Reports have been tabled in Parliament about the difficulties refugees and asylum seekers face in getting equal access to health care. There are recommendations for better training of hospital staff, clearer policies on the rights of refugees, and increased funding to help balance the load between citizens and non-citizens. Whether these recommendations will be acted upon remains to be seen. From a broader African perspective, South Africa is not alone in facing these dilemmas. Countries across the continent are struggling with how to balance their own citizens' needs with their obligations to refugees and asylum seekers. Yet, South Africa, as one of the continent's economic powerhouses, is often expected to lead by example. That adds more pressure on the government to find a solution that is both fair and practical. At the heart of this issue is the question of dignity. Healthcare is not just about medicine and treatment. It is also about recognizing the humanity of each patient who walks through the door. Refugees and asylum seekers argue that when they are turned away, it sends a message that their lives matter less than others. This is why activists are pushing so strongly for reforms, because for them, healthcare is not just a service, it is a right. As South Africa continues to grapple with this, it is clear that there are no easy answers. The country is already dealing with unemployment, inequality, and limited resources, so any discussion about healthcare for non-citizens is bound to be controversial. But ignoring the issue will not make it disappear. Refugees and asylum seekers are already here, and their health challenges will affect the wider community if left unaddressed. For now, the voices of refugees and asylum seekers continue to grow louder, backed by advocacy groups who demand accountability and fairness. Whether the government responds with compassion and clarity, or whether politics will overshadow the issue, is what remains to be seen. What is certain is that healthcare discrimination, if left unchecked, undermines the values that South Africa's democracy is built upon. And on a lighter note, sometimes it feels like South Africans need a sense of humor to get through these challenges. As one person joked online, maybe the government should at least make sure the queues at the clinics have shade and Wi-Fi, since people will be waiting for hours anyway. Another said if they can survive home affairs lines, then the hospital lines are just training for patients. A little humor doesn't solve the issue, but it reminds us that people are still finding ways to cope with the hardships. That's all for today. Remember to subscribe to the channel so you don't miss future updates. All images used are for illustration purposes only. The news sources for this report include News 24, Daily Maverick, Times Live, and Ground Up.